Now, we want to apply, if you would help me, we're going to apply cold towels onto his neck, and we're going to be constantly wringing these out and recooling them, because that's the first thing that we want to do. Say his temperature is 105.4. We've got to get moving. It's very important to cool him down. So with our heat stroke, we're going to place the cold wet towels. Then we can transport him to somewhere where there's preferably a hose. We're going to use that hose to keep running water going over him cold, especially the abdomen area and behind the legs, and even kind of in the groin. We can use our hands to massage its legs and sweep the water away as it absorbs the body heat. We're going to continually check his temperature, and we're going to stop once the temperature reaches 103.5. It's important to monitor the temperature of the animal, because hypothermia, once again, is something we want to watch out for. Since we're trying to rapidly cool him, we don't want hypothermia to set in. And then if you're doing this at home, you are going to want to, hopefully have maybe some ice and water, so you can do this with the towels as you're transporting your animal to the veterinary clinic, so that maybe when we get here, the vet might say that we may need to start him on fluids or continue the cooling process. So it's just very detrimental that you get your dog started with the cooling, and then get him as quickly as possible to a vet clinic. Next, we're going to move on to shock. With shock, there's two types of shock. There's compensatory and decompensatory. Decompensatory is the most severe. Shock deprives the dog's brain of oxygen and can be fatal if not treated. So clearly, shock is very important to get treated as soon as possible. You can check your pet's capillary refill time by pressing on the mucous membranes of his gums, and hopefully the pink will come back in less than 2 seconds, to get an idea of their perfusion rate, because circulation is greatly reduced if in shock. Signs can be weakness, collapsing, dullness, depression, loss of consciousness, rapid but weak pulse, a fixed stare, the dilated pupils, which is an idea of his mental status. Those are just some signs of a dog in shock. You would also want to watch his urine output, check the smell, how much, what it looks like. You're definitely going to want to check his femoral pulse. There's shock usually follows severe injury or extreme fright, just like how maybe people get into a severe car accident. It's the same with animals as well. You're going to want to keep the animal restrained. So if you'll place right here and right down here. So we're going to want to keep him restrained, warm and quiet. So blanket and just try and calm him down. If the animal is unconscious, we're going to keep the head level with the rest of the body. So we don't want the head drooping down off the table or a couch. You're going to want to transport the pet immediately to a veterinarian. There's several different types of shock, but just a few that I can name off are hypovolemic, which is low blood volume, cardiogenic, which is related to the heart, endotoxic, which is, toxicity inside. So moving on from endotoxic, we're going to discuss poisoning and exposure to toxins. I'm going to explain if you say Jonathan brought his dog in and he's worried that his dog has been poisoned, I'm going to kind of explain to him what he needs to look for, what he needs to do. So first off, poisoning. There's a lot of things that could be poisonous to animals that I'm sure a lot of owners are greatly unaware of. Of course you have your cleaning products and your rat poisons and antifreeze, which is, big one. Those are more of the obvious. But there's also a lot of common foods that could be harmful to your pet. And I'm just going to explain a few of those to you, such as apple seeds, apricot pits, cherry pits, peach pits, avocados, that's the big one, grapes and raisins. They can have a grape and raisin toxicity. Onions and onion powder, so they're toxic. Onions are toxic to dogs. Xylitol, which is the artificial sweetener, and say the gum that you have in your pocket. If your dog gets a hold of the whole pack,